lateral side of the face first, just like you see in the picture, the lateral side of the face. Okay? The first structures you want to find are the most delicate and the ones that you're likely to destroy if you're not careful, and those are any ducts and nerves. So this is the masseter muscle, that muscle that's in your cheek. Okay, masseter muscle. If you look in the picture, you can see a yellow strand at the top of the masseter, a green strand, and then a yellow strand at the bottom. We are not going to look for the top yellow strand. We're going to look for the bottom two structures. So you see this flat white thing here? That's the parotid salivary duct. See that? Underneath it, do you see this white thin structure? That's the facial nerve. Vessels are colored, so it helps us. Nerves are white, and they're sometimes hard to see and easy to miss.
So the parotid is the first one?
Correct. You see how flat that is? Parotid duct? Because there's no saliva in it, right? But if it was expanded during lacrimation and saliva production, then it would be enlarged. But the nerve is just a single strand of white. Now, it's not going to look like this in your cat. It's going to be covered in fascia, so you're going to have to take a blade or scissors and cut it and isolate it up so it's easily seen. Okay? So once again, platysma muscle, reflect it back, locate the masseter, find the duct, and the nerve. Okay? The next things you want to look for are on your list there. Do you see those green cauliflower-looking structures?
Yeah.
Those are glands. Those are your salivary glands. And they do look like that in the cat. You see this one here? It kind of has what looks like rugae or striations in it. Okay? That's the mandibular salivary gland. And then the one right under the ear, just like in your picture, is the parotid salivary gland. And the parotid salivary gland sometimes has fat over the top of it. You just kind of have to remove that fat. Okay? So parotid salivary gland, mandibular salivary gland, parotid salivary duct, facial nerve, masseter muscle. Okay? Not in the picture there. It's on other pages you guys can look at. There's another set of little glands here. Do you see these tiny little glands? And there's a vessel running right in the middle.
So parotid,
mandibular.
and then over here.
Correct.
Okay.
Yep. So parotid salivary gland under the ear, mandibular salivary gland right under the ramus of the mandible. And then these two here are actually not salivary glands, they're lymph nodes. So those are the mandibular lymph nodes. If you've taken 128 and we've palpated those, this is what you're trying to feel. Mandibular lymph nodes right here. Okay? The other things you want to use from this picture are the vessels. Okay? External jugular vein you can see very easily, even on the side we didn't dissect. See that right there? So when we draw blood for venipuncture, this is where we're getting blood from. Though we just call it the jugular vein, it's actually the external jugular vein because there's an internal one deep inside the neck next to the trachea. Yes, thank you for pointing that out. Do you notice that some of those say left and right? Okay, so make sure that you write down left or right when you are doing your quiz to make sure you can differentiate the difference. So this is the right side of the cat that we're dealing with. Okay?
So we're doing it as the head right here?
So it's the cat. It's the cat's right head. So it's opposite of what you are if you're looking face on.
Yeah, so if you were like this, it would be left, right, but it's actually, okay.
Yep, so this is the right side of the cat. External jugular vein. Everybody see that in the picture? External jugular vein. Do you see how it branches into 3 different vessels after that? Look at your picture. Branch 1, branch 2, branch 3. Okay, we're going to branch it. Here's the first one. Transverse jugular vein. Do you see it? It's actually going from one jugular vein.
Oh, we have a tick.
Oh. Is it? Yeah? Transverse jugular vein goes from the one external jugular vein on one side to the other external jugular vein on the other side. So there's no left and right transverse. There's just one moving across. Correct. Now this is where it's going to change a little bit from your book because Dr. Alderson's lectures are a little bit different with labeling than what's in your book. It branches into what your book says is a dorsal facial vein and a ventral facial vein. Do you see that? So you see the three branches. You have the external jugular vein. The first branch is that transverse. We already talked about it, right? And there's two more. 1, 2. Dorsal and ventral.